Here we see a pictorial representation of the classification of the various study designs that we have in epidemiology. So broadly speaking, they are divided into observational and experimental or interventional designs. And under the observational designs, we have those that are descriptive and those that are analytic. And under experimental designs, we have randomized controlled trials, field trials, and community trials. Again, this table shows the various classification and the alternate names for the various study designs. If you learn about different study designs and the advantages and disadvantages, you are in a better position to interpret and evaluate the results from various research. The most important distinction of an experimental study design compared with a non-experimental or observational study design is the exposure assignment. One example of this would be randomizing one group of patients to get the new breast cancer chemotherapy drug and the other group of patients to receive the current standard chemotherapy. Note that the exposure is the intervention. For example, a new drug treatment, and in an experimental study, the investigator usually determines who is exposed and who is not exposed. The exposure or intervention is randomly allocated to study participants. To test if bed nets reduced infants contracting and dying from malaria, researchers randomized a group of infants to receive bed nets from birth onward. The control group of infants received bed nets only after 6 months. The researchers found that the use of bed nets in infants reduced the rate of both developing malaria and dying from malaria. In a non-experimental observational study, the investigator does not assign exposure status. For example, in an observational study on the health effects of living near nuclear reactors, such as Fukushima, the investigator does not assign some people to live near the nuclear reactor and others to live far away from the reactor. Another example of a non-experimental study would be to follow a group of diabetes patients over time, some of whom smoke tobacco and some don't, and then look at what their rate of cardiovascular disease will turn out to be. Examples of experimental study types include randomized controlled trials, which we will be discussing in greater detail soon. And examples of non-experimental study designs are cohort studies, case control studies, ecologic studies, and cross-sectional studies. So we begin with the first study design, which is experimental study design. An important difference between experimental and non-experimental studies is the randomly assigned exposure. Randomization is important because it minimizes differences in key characteristics between the group that gets the exposure and the group that does not get the exposure. But it's not ethical to randomly expose people to serious hazards such as radiation, toxic chemicals, or inadequate health care. Therefore, experimental study designs don't work for everything. Instead, researchers use observational study designs in those circumstances. In experimental studies, subjects are assigned by a formal, usually chance mechanism between two or more exposures or interventions. Experimental studies are the gold standard for inferring causality. Commonly, experimental studies provide participants with an exposure, such as a drug, that may be either therapeutic or preventative. The provided intervention is usually randomly allocated to study subjects by the researcher. Next, we'll cover the ideal type of experimental study, which is the randomized controlled trial. In a randomized controlled trial, the treatment of interest, such as a new drug, will be randomly allocated to half of the study subjects, and the other group will receive a placebo or the current standard of care or medication for that disease. An example of a randomized controlled trial would be a study comparing two different treatments for arthritis. Subjects will be randomized to one of the two arthritis treatments. There are both individual and community experimental studies. An example of an individual experimental study is where one group receives an experimental drug aimed at preventing Alzheimer's disease in an at-risk group, while another at-risk group receives a placebo. Experimental studies can also be targeted to communities rather than individuals. An example of a community intervention is a colon cancer screening program that was implemented in 9 counties and 7 control counties who did not receive the screening program. In an individual level experimental study, some study participants are assigned an exposure and the remaining participants are assigned to be unexposed or exposed to a different factor. In a community level experimental study, 1 or more communities are assigned to an exposure. 1 or more other communities are assigned to be unexposed or exposed to a different factor. Randomized control trials are often used to test the effectiveness of new interventions or compare the effectiveness of 2 or more interventions. The key feature is randomization. That is, subjects should be systematically assigned to the study groups in such a way that each has an equal chance of being placed in each of the groups. And this is known as random allocation. Randomization eliminates selection bias, which leads to wrong conclusions about relationships between variables. It's also important that the intervention group and the control group are comparable in all aspects except that intervention itself. For example, the proportion of females and the age distribution should be similar in both groups, since these variables could have an influence on the effect of the intervention and thus impacts the research findings if disproportionately represented in one group. Randomization also helps to ensure even distribution of known as well as unforeseeable confounders, though this may not always be guaranteed. Randomization provides the strongest evidence for causal inference. Randomization basically allows us to ask, if everything else is the same, what is the effect of just the exposure on the outcome? For example, if assignment of a treatment was not random, the researchers might select which participants got which treatment based on patient characteristics, such as severity of illness. This could bias the study results. Randomization is done with a computer software or some other method which is used to assign subjects or groups to receive one exposure, treatment, or another. It is the most important component of the experimental study design. Now let's look at an example of a randomized control trial. Researchers designed a randomized control trial to answer this research question. Do U.S. Postal Service mailmen who receive a specific sun safety education intervention subsequently wear wide-brimmed hats and use sunscreen more than the U.S. Postal Service mailmen who did not receive the sun safety education intervention? The intervention included 6 educational sessions, wide-brimmed hats, sunscreen, and reminders. Workers were randomized to sun safety promotion or delayed sun safety promotion education. Postal workers in the intervention group received 6 educational sessions and were provided with wide-brim hats, sunscreen, and reminders. The postmen were then followed up for 2 years to assess the outcome. The researchers found that the postmen who received the intervention had increased use of sunscreens and hats compared with the control group. So what are the key advantages of randomized control trials? First, randomization reduces confounding, that is the influence of other factors that could determine the outcome of interest. This study design provides strong evidence for causality or causal inference. Since investigators assign the exposure, the time or temporal relationship between the exposure and outcome is clear. So while there are advantages to randomized control trials, it is important to know that there are also disadvantages. Randomized control trials can be costly. Sometimes, randomized control trials have issues with external validity. People who participate in trials may be very different from the rest of the population. Thus, the effects seen in the participants may not be generalizable to the population at large. In addition, there are ethical considerations when randomizing treatments or exposures. For example, it would be unethical to do a study that would involve randomizing people to be exposed to a non-toxic substance, such as water containing high levels of arsenic, mercury, or lead. To summarize, in the randomized control trial, researchers follow the treatment and intervention and the control comparison group to see who develops the health outcome or disease of interest. We now look at some important terms using experimental study designs. The first is blinding. In the context of experimental study designs, blinding is a technique used to conceal certain information from different people involved with a study. This is important because knowledge of certain information could lead to biases in the study. For example, if a subject knows that they received a trial therapy, they may report their symptoms, activity levels, or level of well-being differently than if they didn't know whether they got the medication or not. Similarly, because they are very invested in the trial medication working, the researchers may perceive or interpret data differently in those who received the medication than those who did not. Therefore, it may be necessary to prevent researcher and study subjects from knowing who received what. A single blinded study is one wherein either the subject or the researcher or the analyst, that is just one category, is blinded. In a double blinded study, both the subject and the researcher are blinded. And in a triple blinded study, the subject, the researcher, and the statistical analyst are all blinded. What is a placebo? These are sham medications that appear identical to the real treatment but lack that treatment's active agent. Placebos are used in order for the different groups to not realize if they are exposed or unexposed to the intervention or drug under investigation, which would affect the participants' behavior or measured health outcome. Compliance or adherence refers to whether or not participants follow the treatment medications or recommendations, as some participants may not stick with their assigned treatment or exposure. When we talk about intention to treat analysis, we usually refer to when subjects are analyzed according to their randomized treatment, regardless of whether they actually got or took that treatment. This concludes our discourse on experimental study designs. The most important thing to remember is that randomization of exposure is a key component of an ideal experimental study design.